here's the main part of the Inspire device, which is the generator. And the way I like to describe it is it's like a pacemaker for your breathing. And it's used to treat sleep apnea, which is a condition where people start and stop breathing many times overnight. So this device works by sensing the patient's breathing and providing a gentle stimulation to the nerve that controls their tongue. And this basically allows their airway to open up each time at night when they're breathing in, and it synchronizes with their breathing. And I think one of the cool things about this procedure and what really sets it apart is the patients have control over this. It's not something that's done to them. They have a lot of ownership in it, and I think that comes down to this remote. It's really simple and intuitive to use, and essentially once the patient's healed up, they're feeling good, we turn it on, we give them a thorough explanation on how to use it. But it's quite simple, and they just turn it on at night, go to sleep, and then after they're asleep, 30 minutes later, every time they breathe in, they'll be able to have that airway open up, and of course that's going to prevent the snoring, prevent the apneas, and ultimately they're going to be feeling a lot better. Well, yeah, everything has to have an app these days, I think. So I think the nice thing about the app is, again, it gives patients a lot more information. They can see how they're doing. It's not a black box anymore to them. They can check each night and see how well they're sleeping, see how well they're using the device. But also importantly for the providers and the physicians and the providers who are treating these patients, we can check on them without having them to come into the office every time. Which I think is important because for many of us, sometimes patients are coming from hours away, and being able to just log on to a portal, check and see how your patient's doing, I think that is really powerful and has led to, I think, a lot of satisfaction for both providers and patients. The most important thing to know, first of all, is this is a surgery, it's a procedure, and I normally will start with that, and I'll explain that it's an outpatient procedure. It's done by placing 2 incisions, one in the neck and one in the chest, and we'll wrap an electrode around the nerve that controls your tongue, and we pass a wire into the chest and plug it into the battery that controls the device. I think it's important to know that the battery lasts for about 10 years, so there's not a lot of maintenance there, but they will need battery changes about every 10 years or so. And then there's a small breathing sensor that goes between the ribs, and that will allow them to synchronize the stimulation with breathing. And it's an outpatient procedure, so they'll go home that day. And typically there's not a lot of pain or really rough recovery, just some sore throat and maybe a little bit of swelling and bruising over the incisions. But I find that patients get back to their daily activities pretty quickly. It's nice to know that we're using the body's natural physiology. In fact, the way that we all just don't have sleep apnea is because of the fact that we have good tongue tone in our throat normally. So normally whenever anybody breathes in, your tongue will actually stiffen and move forward slightly. It's not to the point where it's really perceptible, but that is really the natural process that prevents anybody from not having sleep apnea. And so this device is just kind of supercharging that and taking the natural process and enabling it to be effective for the patient so that they can get a good night's sleep. For me, I think one of the things that gives my patients confidence is I've done about 300 of these procedures, and I've tracked my outcomes very closely and my complications very closely. And thankfully, they're rare to have complications. The complications that do happen, we have good ways to treat them. And so I find that, giving them that peace of mind, we're not going to be in for any surprises. We know we've been doing this for many years, both myself and Inspire as a company. A lot of the kinks have been worked out at this point, and I think patients can rest easy in that fact. What we all, want to do is just be able to put our head down on the pillow and go to sleep. And when you're talking about CPAP, you're talking about wearing a mask on your face, maybe not being able to sleep in certain positions. Even if the CPAP works, it's typically not comfortable and it can disturb the bed partner a lot. Of course, I think if CPAP works, that's great, and we have seen many patients like that. But I think for the patients we're seeing are the ones that are really struggling with CPAP, and I think the aha moment for them is just being able to go to sleep maybe the way they used to. it's not a medical procedure anymore to go to sleep. They just simply click a button, go to sleep. They can sleep on their stomach or their side or their back. There's no hissing or noise to it. And, they wake up feeling refreshed, which is, what we all want out of sleep. In terms of risks with this procedure, I am really confident in the safety of it. I've seen in my own patients an exceptional safety profile for this procedure. The risks are very low. Certainly with any procedure, there's always risks, and so the risks are not zero. But I think the important thing is that the risks and the complications that we could have tend to be quite mild, things that get better with time, or worst case scenario, typically things that we can resolve easily. In terms of the cost of the procedures, of course, we're talking about an implant. It's a complicated device, so there are costs associated with it. But I think, thankfully, where we are now with insurance coverage, the cost to the patient tend to be quite low. And so I can't actually recall any patients complaining to me or bringing up to me that they've gotten a large bill after the surgery. We work with both internally, our own billers and reimbursement specialists, and also the folks at Inspire to make sure that there's not any surprises. And I think that's the main thing, is people don't want to be surprised. And so I think they always have a good idea of what the costs are going to be going into the procedure. Yeah, I do love working with the Inspire device and providing this therapy for patients. What actually got me into being a physician and motivated to be an otolaryngologist and an ENT surgeon actually was sleep from the very beginning. So even before I really knew what it was to be a doctor, I knew I wanted to help people sleep. And that was through some of the mentorships that I had early on, and I just saw the power of people who couldn't sleep well. What did that do to them? What did that do to their mood, their careers, their relationships, their marriage? And then on the flip side, seeing that all improve, hearing about patients dreaming for the first time in so many years, hearing about the connections that they're forming with their spouses again, being able to spend that close time together again. And so with Inspire, I've been able to see that over and over again every day, which just makes my day so fun. And it's, I think, even better because the way we used to treat sleep apnea was so much more invasive. And so we get the payoff without the cost of that really rough recovery. Patients have just really minor discomfort, and then after a short recovery period are already on their way to realizing all of these benefits. And so it's just day after day, patient after patient, seeing all these happy people, hearing about their stories, the travels that they're having, how they're involved in their grandparents' lives, their grandchildren's lives, and things like this. Has been really rewarding for me, and that's really what motivates me every day and keeps me providing this therapy. One of my early patients, actually, that I implanted with Inspire some years ago, it was funny, she came to me initially and she was so tired. She just talked about going to work and just even right in the morning after a cup of coffee, just laying her head down on the desk. And she was so distraught by this because she just felt like she wanted to do a good job and really couldn't. There was nothing she could do about it. And now seeing her after Inspire and following her for years and years and years, she's a 70-year-old woman and now dyes her hair blue and does things like visit the polar bears in the Arctic. And I always get the biggest hug from her, and that just makes you feel great. I think the process of getting Inspire, it's really a journey for the patient, and so the process of getting Inspire is really a journey for a patient, and through that process, they're going to need to have care from their surgeon, but also from their sleep medicine doctor. And we both do different things. The surgeon, is going to be really involved in performing the initial airway exam, making sure you're a good candidate for this procedure, and of course doing the surgery and the immediate post-operative care. And some surgeons also will follow you afterwards But many times, I think once you're doing well with this therapy and you're acclimated with it, you're going to be following with your home sleep doctor, who might be somebody who's even closer to where you live, somebody you're already familiar with and have that relationship with. And thankfully, a lot of these sleep doctors are now very well trained in Inspire. And they're going to be able to follow you over the years, whether they see you every 6 months or every year. And typically, it's just coming in and getting a quick check of your device, answering any of your questions, and making sure everything looks great.